Good day, I am Daniela Villancero-Manilios, and today I'll be demonstrating urinary catheterization. So this procedure is done to drain urine from the bladder when a patient cannot urinate on their own, to relieve bladder distension, to collect a sterile urine sample, or to closely monitor urine output. It is also commonly used after surgery for comfort and accurate measurement. So the goal of catheterization is to promote patient safety, comfort, and proper management of their condition. Okay, first, I must check the doctor's order for catheterization to make sure the procedure is authorized and appropriate for the patient's condition. Okay, next, identify the patient and explain the procedure because this ensures correct patient safety and helps reduce anxiety while gaining cooperation. Good morning, ma'am. I'm Daniela Villancero-Manilios and I will be your student nurse for today. Can I please check po for your identification bracelet to confirm your identity? Okay, thank you. Can you please state your full name, ma'am? And your date of birth? Okay, thank you, Ms. Rojas. So today I'll be doing catheterization. I will just be inserting a small tube into your bladder to help drain your urine. So this will make you feel comfortable and also help us monitor your condition. So the procedure might feel a little discomfort or uncomfortable down there, but it should not be painful. I'll make sure to keep you safe and comfortable while I do it. Do I have your consent to proceed, ma'am? Okay, thank you. After that, I must perform hand hygiene and observe proper or appropriate infection prevention procedure to eliminate microorganisms and prevent cross-contamination of microorganisms. Then, I will provide patient privacy by screening or closing the door to protect the patient's dignity and promote comfort. Now, I have positioned the patient in dorsal recumbent with knees flexed so that the urethral opening can be exposed and accessed more easily. Okay, ma'am. Thank you. Yes, your knees like that. Oh, very good. Now, following this, I will drape the patient while exposing only the perineal area to maintain privacy while still allowing access to the site. Now, to improve visibility, I will apply direct light to the genital area because good illumination ensures accurate visualization of the urinary meatus. Okay, so assuming that this is the direct light source. Yes. Then I'm gonna place the urine bag beside the bed frame below the waist level of the patient to prevent backflow of urine. And I will open the tray and arrange equipment accordingly to avoid contamination of the sterile items. So I have prepared also the necessary materials. We have here the two-way catheter, and I have used the drainage bag, the cleansing solution, cotton balls that are soap, a sterile urine container, a tape, and the catheter set. So we have here the eye sheet, the sterile gloves, then we have the sterile pick-up forceps, the lubricant, the 10cc syringe filled with sterile water, the cotton balls, and now we're gonna open the catheter so that later on we can proceed and do not get the catheter contaminated. Now, after arranging, I will place a waterproof drape under the patient's buttocks without contaminating the center so that the bed is protected from being soiled while the sterile field is preserved. Okay, ma'am, I want you to turn gently to your side po, ha, so I can place this protective sheet under you. Okay, thank you. Now is to, I'm going to apply sterile gloves while observing sterile technique because this prevents microorganisms from entering the urinary tract. Now I will attach the prefilled syringe to the indwelling catheter inflation to prepare for balloon inflation once the catheter is correctly positioned. Then I will lubricate the catheter within 2.5 to 5 centimeters, being careful not to plug the drainage eye so that the insertion is smoother and urethral trauma is minimized. Now, I will place the eye sheet over the area in order to maintain a sterile field throughout the procedure. Okay. So, after preparing the sterile field, I will cleanse the urinary meatus to reduce microorganisms and prevent infection during catheter insertion. The nails, then discard. On the other side. For the third. Same. And last. Now I will pick up the catheter 3 inches from the tip of the thumb and place the thumb and one finger of the left or right hand between the labia minora and separate and pull up gently so the meatus is clearly exposed and the sterile catheter tip remains uncontaminated. Then I'm going to insert the catheter within 2 to 3 inches or until urine flows, because the return of urine confirms correct placement in the bladder. Okay, now if specimen is to be collected, I will pinch the catheter using the non-dominant hand, thumb, and the finger while placing the specimen container in position to collect a sterile sample without contamination. Now, after specimen collection, I will hold the catheter with the non-dominant hand and inflate the retention balloon with a designated volume. So, this is to secure the catheter inside the bladder and won't slip out. Next is to connect the catheter to the urine bag, making sure no tubing falls below the top of the bag to prevent backflow of urine and reduce risk of infection. Then I will wipe away any remaining antiseptic or lubricant from the perineal area so that the patient remains clean and comfortable. Now I will secure the indwelling catheter by taping it to the patient's thigh, allowing some slack of the tubing to accommodate the patient's movement to prevent accidental pulling and reduce trauma during movement. Okay, ma'am, I will tape this to your thigh po, ha? Now I will discard all used supplies in appropriate receptacles and remove gloves, then discard, since proper disposal prevents cross-contamination and infection spread. And then I'm gonna remove the eye sheet. Now, after that, I will place the patient in a comfortable position to promote relaxation and well-being after the procedure. Okay, ma'am, thank you for allowing me to put the catheter in you, ma'am. Thank you. Also, perform aftercare of all the materials used to prevent infection and keep the unit clean. Since done, I will now document the catheterization procedure, including the catheter size and results in the client recording or client record using forms or checklists implemented by narrative notes when appropriate to provide an accurate legal record and ensure continuity of patient care.